I'm pleased to see that our leading and lagging indicators have declined or remained stable. On February 8th, our positivity rate for lab-confirmed PCR tests was around 30%. Today, it is down to 20.5%. 1 month ago, there were 1,664 people in hospital with COVID-19, including 134 in intensive care. Today, there are 1,106 and 77 people, respectively. New daily admissions have dropped almost every day for over a month since they peaked on February 7th. All this data, combined with high levels of vaccine protection in Alberta, confirms that it was the right time to transition our response to COVID-19. Over the course of the last few weeks, we have slowly returned to a more normal way of life as Omicron transmission has decreased and the pressure on our health system has eased. But as we ease restrictions and move forward together, we cannot ignore the strain that COVID-19 has placed on our healthcare system. We must build our system capacity to ensure that Albertans continue to get the high-quality care they need and that they deserve. That's why we're investing $300 million over 3 years to add ICU capacity. This includes allocating $100 million for up to 50 new permanent ICU beds this year, and another $100 million in each of the following 2 years to keep those beds operational. These new ICU beds will be distributed in all AHS zones across the province, with further details on locations currently being developed. Our goal is to ensure maximum flexibility so the system can surge as needed and resources can be redeployed to support other parts of the health system when ICUs are not facing pressures. The pandemic has shown us that we need more permanent beds, more staff, and more resiliency within our system so we can be fully prepared for any future health crisis. We expect them to come online in the coming months, and AHS is working on plans to recruit and train the necessary staff to operate these new beds. Having the staff to take action in ICUs and at healthcare facilities across Alberta is a top priority. And that is one of the reasons why today I have directed AHS to rescind its immunization of workers for COVID-19 policy effective March 10th at 4 p.m. This directive covers employees of AHS, its subsidiaries and Covenant Health employees, members of the medical and midwifery staff, students and instructors, volunteers, and applicable contracted service providers, including those working on AHS sites and separate providers under contract. This change is in line with policies in other jurisdictions, including Manitoba and Quebec. As of 4 p.m. tomorrow, AHS will no longer require currently unvaccinated employees to do mandatory rapid testing. Employees on a leave of absence due to immunization status should work with their managers to determine their return date. I know that a draft copy of this directive was leaked last week. However, I want to reiterate that the current directive signed off and released today with an effective date of March 10th at 4 p.m. is what will be implemented. When this immunization policy was implemented late last year, it was to protect patients, healthcare workers, and the public during a time of record transmission and an incredibly severe wave of Delta. And at that time, we committed to reviewing the policy by March 31st, 2022. Fortunately, now, we are at the tail end of the Omicron wave, and with our high vaccination rates, we're in a very different situation. We're extremely grateful to all those workers who chose to get immunized. This was essential over the last year to protect themselves, their patients, and our healthcare system. I know AHS continues to recommend COVID-19 immunization to all its staff and will continue to work with those who choose not to get immunized to address their concerns, answer their questions, and educate them about the importance of immunization and vaccine effectiveness. Outside of the health system, we continue to follow the evidence to make sure Albertans are protected by vaccines, including additional doses as necessary. That's why, following the recommendation of the Alberta Advisory Committee on Immunization, I'm pleased to announce that beginning March 14th, Alberta youth aged 12 to 17 who have had their second dose at least 5 months ago will be able to receive a third dose. I know this is welcome news for many parents, guardians, and youth. Dr. Hinshaw will provide more details on when and where appointments will be available. As you know, we are also in the middle of a 2-week effort at AHS clinics to get more children between the ages of 5 and 11 vaccinated. To make it easier for parents and guardians to get their kids immunized, clinics across the province are providing pediatric doses on a walk-in basis and extending clinic hours. In the first week, more than 6,500 first and second doses have been administered. This is great news for young Albertans, their families, and our communities. We'll continue to work to increase boosters in the general population and make pediatric vaccines available for families who choose to get them for their children. Now, if you have questions about a COVID-19 vaccine and whether or not it's right for you or someone you love, please speak to a health professional like a family doctor or pharmacist, or call 811 HealthLink. They can answer your questions and give you accurate information. So thank you, and I'd now like to invite Dr. Hinshaw to the podium.
Thank you, Minister, and good afternoon, everyone. 2 years ago today, I shared the news that we had our first officially confirmed case of COVID-19 in Alberta, and that we had a total of 4 presumptive cases. At that time, we had no vaccines, we had no antivirals, and we still had much to learn about the virus. We have come a very long way since then. What we've seen over the past 2 years is extraordinary. The speed of identification and sharing of new information on this virus has been without precedent. Along with others around the globe, we have continually used the latest research and findings to translate into best practices to protect us from the worst impacts of a virus the world had never seen before. I know that we will continue to adapt as we transition into this next stage. Change is difficult. It is especially difficult when there is no single right answer to the challenges we face. We no longer need to respond to COVID as the biggest health threat we collectively face, and yet we still need to mitigate its direct impacts. This might seem contradictory, and this is part of why finding our way forward is so hard. We need to be able to hold 2 realities at the same time. One is that COVID is still a threat to take seriously, and the other is that the COVID population risk has been reduced, and we can move to seeing COVID as one risk among many, one we cannot fully eliminate, but that we can manage. Given the tension between these 2 realities, one of the most important tools in our way forward is dialogue and understanding different perspectives. I ask that all of us continue to do our best to be gentle with ourselves and with others as we go through this transition. It's inevitable that we will have difficult days, and we will also have good ones, as we have throughout the last 2 years. We can strengthen the relationships in our communities to help us all get through. Turning to today's update, over the last 24 hours, we have identified 467 new cases of COVID-19 and completed about 2,200 PCR tests. Our positivity rate is 20.5%. As the Minister mentioned, there are currently a total of 1,106 people with COVID-19 in hospital, including 77 in the ICU. Sadly, 7 new deaths were reported to Alberta Health over the last 24 hours. My condolences go to the family and friends of these Albertans and to anyone who's experienced a loss from any cause. These deaths remind us of the reality I mentioned earlier, that the virus is still with us and can pose a serious threat for Albertans who aren't vaccinated or who have additional risk factors. That's why, even as we move forward with easing restrictions, we are being cautious in high-risk settings and leaving protections in place to help protect vulnerable Albertans. This includes continued mandatory masking in all continuing care facilities, acute care settings, and on public transit. As provinces across the country and jurisdictions around the world begin working towards an endemic approach to COVID, many adjustments are needed. After 2 years of mandatory public health measures and fundamental changes to the way we have lived, worked, and socialized, This will not be easy for all of us, especially for those who may have an increased risk of serious outcomes from the virus. We need to assess the COVID risk for ourselves and our families and make the best decisions possible for our unique circumstances. It's critical that we respect the choices that people make and show patience and tolerance to those who are making different choices than we make for ourselves. As we're considering how to best protect ourselves and our families, one finding that has stayed solid is that vaccines are highly effective at preventing severe outcomes. Currently, over 3.35 million Albertans, or more than 86% of everyone over the age of 12, have received 2 doses of COVID-19 vaccine, while close to 1.6 million have gotten their booster dose. It is because so many Albertans have willingly rolled up their sleeves to get the vaccine that we are at this point today. Long after restrictions are lifted, vaccination against COVID-19 will continue to be an important part of Albertans' health and well-being. That's because we know that vaccine remains the single most effective way to prevent loss of life, hospitalization, and severe outcomes from COVID-19. This reality makes today's announcement about booster doses available for all youth between the ages of 12 and 17 an important one for many Alberta families. While the risk of severe outcomes for these youth is low compared to those in older age categories or for youth who have health risk factors, the Alberta Advisory Committee on Immunization has recommended offering boosters as an option for this age group to help increase their level of protection against COVID. This is in line with guidance in other jurisdictions, including BC, Ontario, Saskatchewan, and Quebec, where boosters are being offered to those between the ages of 12 and 17. I know many Alberta youth and parents have wondered when they would be eligible for additional protection against Omicron, especially as restrictions on youth activities and schooling are coming to an end. 3rd dose appointments for those aged 12 to 17 will begin on March 14th and can be booked immediately through the Alberta Vaccine Booking System or by calling HealthLink at 811. These booster doses will be administered at AHS clinics and participating pharmacies province-wide. For most adolescents without risk factors, 2 doses still offers good protection against severe outcomes. However, we know that some in this age group live with high-risk household members or may have other factors that make this 3rd dose important as an added layer of protection. If you have questions about whether or not a 3rd dose is the right choice for your child, please talk to a healthcare professional. I also want to mention updated guidance released by the National Advisory Committee on Immunization last month related to the time period between infection and receiving vaccine. It is now recommended to wait 8 weeks after COVID infection before beginning or completing a primary series of vaccine, and to wait 3 months after infection before getting a booster dose. For those who have already received vaccine at a shorter time interval, there is no need for concern. This new recommendation simply gives guidance on what provides a good balance of benefit at a population level and is one factor to take into consideration as you talk to your healthcare professional about what is right for you and your family. Thank you, and we're happy to take questions.
Thanks, Dr. Hinshaw and Minister Copping. No reporters here in the room with us, but a couple on the phone. So, operator, we'll go to the first caller, please.
Thank you. Matt Woodman, CTV.
Hi there. My first question is for Dr. Hinshaw. There is a divide between the province and the city of Edmonton when it comes to masking in public places. I was curious, if the city of Edmonton came to you and asked for your recommendation whether to keep masking or to drop it, what would you tell them, yes or no?
As you'll recall, a few weeks ago, I made the statement, which I still believe, that masking is a prudent public health measure. And at the same time, the policy rules around masking are difficult ones that have to be made by weighing advantages and disadvantages. So it's critical that we work with local partners as we're considering how to respond to COVID, and how local partners are engaged and how we work with them. Those are policy decisions that are made by elected officials.
Thanks, Dr. Hinshaw. A follow-up, Matt?
I do. This one is for the health minister. Minister Copping, is there any plans to bring back PCR testing for the general population?
Thanks for the question. There's no plans to bring back PCR testing for the general population at this time. But this is a similar approach that's being taken across the country. We are focusing our resources on PCR testing for high-risk individuals and high-risk locations. But given that we're coming down the other side of Omicron and moving into endemic phase, we don't see the need to actually open up PCR testing for right now. But then again, we'll continue to watch the numbers, what the next wave may bring, and we are maintaining a core amount of capacity to be able to do PCR testing for the future.
Thanks, Minister. We had just 2 outlets on the line to start with, so we'll go to the second one, which will be our last one for the day.
Lauren Pullen, Global Calgary.
Hi there. Thanks for taking my question this afternoon. My first one is for Dr. Hinshaw. We've heard the messaging in the past few weeks here about learning to live with COVID, and even today you spoke about the 2 realities. Are you able to provide a bit more insight and break down what that practically means? For most Albertans, is that just about shifting back to normal life pre-pandemic? Or what is your advice on learning to live with COVID, including for the vulnerable and immunocompromised in our province?
It's a good question, and it really underscores the fact that there is no single reality about living with COVID. So for those who have an immune-compromising condition, for those who are at higher risk of severe outcomes, there is a need to continue to take added layers of precaution. And what learning to live with COVID means for us collectively, I believe, means, again, understanding that respecting what other people's context means and the additional precautions that they may need to take to keep themselves safe, while we're able to have discussions about the trade-offs that are present. Certainly we all know that the precautions and the public health measures that we've needed to take collectively over the past few years have had their own impacts on health. So I think learning to live with COVID means recognizing that we won't eliminate it, that there will continue to be a level of transmission that will come and go over time. We will continue to monitor, and if there are new variants that cause more severe outcomes, we need to be prepared to adjust our approach as appropriate, but at the same time recognize that individuals who are at higher risk will need to take additional precautions for themselves. Those who are at lower risk, again, will need to adjust based on their own risk tolerance. And ultimately, again, I believe it is absolutely critical that we work very hard to support a level of respectful dialogue to help ensure that the relationships in our communities are strong, because COVID is not the only significant issue that we're facing together. And unfortunately, over the last 2 years, there have been divisions that have formed. So I do think learning to live with COVID also means learning to have those dialogues across divisions.
Thanks, Dr. Hinshaw. Lauren, follow-up?
I do, thank you. Just an update, Dr. Hinshaw, on a question you were asked about around the peak of the Omicron wave, about the actual number of cases of the virus, since our PCR testing is so limited and there are no plans to really bring it back unless we need to. With our positivity rate hovering at around 20%, how many cases do we likely have in the province, or how many are we catching with testing?
At that particular moment, as you'll recall, I had estimated that we were catching likely around 1 in 10 was my estimate. Now you'll recall that throughout most of the pandemic, based on our serology results, we estimate that we've caught about 1 in 4. So it's not a new reality that we've had more cases of COVID in the community than we've diagnosed with our PCR program. For many reasons, often people are able to isolate at home and they don't need to go in for testing, and that's fine. So we were typically at 1 in 4, moved to about 1 in 6 for the Delta wave based on our antibody testing. And again, I was estimating in December that we were around 1 in 10. It may have shifted to be even more than 10 per individual case diagnosed. It's difficult to say. I haven't had a chance to look at the latest serology results in detail, but ultimately what I think is really important for Albertans to know is that COVID is still out there and it is still spreading. So those who have risk factors, it's important for them to continue to take precautions. At the same time, the prevalence, the percent positivity has come down. It's about half of what it was at the peak, which is good news, continues to decline. So we will continue to watch that and make sure that we are sharing information that will help people to make the risk-informed decisions that they're taking for their daily lives, for themselves and their loved ones.
Thanks, Dr. Hinshaw and Minister Copping. So that's it for today. We'll see you next week. And of course, between now and then, anyone with questions, please feel free to follow up with us separately. So thanks again.